One Saturday, I saw four people, four separate rooms. Room one was a patient who had badly controlled diabetes because he had lost his insurance and ran out of his meds. We were able to provide him with not only prescriptions for the medications, but diabetic testing equipment, and to refer him to PMAP for some of the more expensive medicines, as well as refer him to diabetic education. In another room was a young lady who had fallen off the wagon and was not taking care of her diabetes, and she was feeling really guilty about that. And so I had the opportunity just to share with her about the everlasting love of God for her and to motivate her to continue to get back on the wagon and treat her diabetes. In the third room was a man that I was seeing back after starting him on medication to treat depression, and he reported how his family interactions had improved so much since his anger was better with the medication. And in the fourth room was a young lady who had walked away from her faith in God because her father had died unexpectedly, and I encouraged her to use the Psalms to help her with her emotions, to express those to God. And I talked to her a few weeks later, and she had started getting back into reading the Bible, and she was definitely feeling like she was growing closer to God. And so there were four different people, four different ways, and that's what we do at Ashland Christian Health Center, providing holistic care in a Christ-centered atmosphere.
So I was here at the clinic on a Saturday morning, and a patient came in asking me for a refill of her antidepressant. And it looked like a pretty straightforward visit. I could have walked in, filled the prescription, and left. But after some discussion, asking her if she'd be willing to explore the connection between her emotional and physical health, she began to tell me quite a bit about her personal experiences, a lot of childhood trauma, and then personal experiences currently with both financial stress and marital issues. So what I basically said was I want to do three things. I said I'd be glad to refill the medication. I'd also like to have her read a book about the connection between our emotional and physical health. And then I also asked her to contact me back in about 2 or 3 weeks by text message or cell phone, whichever she preferred. So about 3 weeks later, she contacted me with a text message, and that's really what was kind of surprising to me, because in the text message she said, number one, the medication wasn't very helpful and she was going to stop it. Number two, she found the book interesting, but it was too emotionally charged for her. The story was bringing up things from her past that she was having a lot of trouble dealing with. And so as I started reading the text message, I thought, well, geez, I've failed as a physician. The medication I gave her didn't work. The book I recommended kind of drummed up some old childhood trauma that she wasn't ready to deal with. But it's the last part of the text message that was really interesting to me, because she ended up spending about 2 paragraphs thanking me for taking the time to listen. And so as I reflected on it, I actually did provide her a lot more benefit than I thought. And it turns out the benefit of the Ashland Christian Health Center for me was the opportunity to listen. And for her, the listening was the best medicine.
Hi, my name is Shirley Irvine. I started volunteering at the Christian Health Center almost 2 years ago now. I heard about it from a flyer at work. They posted a flyer at the hospital that they were in need for nurses to volunteer, and I came on out. I didn't know what to expect. I'd never volunteered for anything like this before. I've never enjoyed picking up work, so it's really amazing that I like coming here on Saturdays. So for the most part, it fills my heart with joy every Saturday that I'm here, and I have met so many amazing people in my journey of volunteering.